Dupuytren's disease is a thickening of the layer of soft tissue underneath your skin and above the tendons. That layer of tissue is known as the palmar fascia, and it just sits underneath the skin, and over time it can cause thickening. Very commonly, it's actually genetic, and it's a slow progressing disease that can occur. And what happens is that because of the contracture of the tissues underneath the skin, it pulls the skin towards your palm. So your fingers start getting pulled towards your palm. It's very commonly confused with trigger finger, but trigger finger is a disease of the tendons, and Dupuytren's disease does not involve the tendons. So arthritis is basically a condition that affects the joint. So you get problems within the joint. You can have loss of cartilage and osteoarthritis, or you can have an autoimmune condition such as rheumatoid arthritis, which produces cells that attack the soft tissue lining as well as the bone inside the joint. Whereas Dupuytren's disease is nothing to do with the joint. It's just predominantly a disease of the soft tissue layer underneath the skin. So the main cause is genetic. So there's a very strong predisposition from the genetic side, and it depends on whether you've got family history. A lot of people don't realize they've got family history. If you look at the scientific literature, they say that this is a disease of the Vikings. It used to be more common in people with Scandinavian descent. Apart from that, sometimes it can happen after a traumatic event to the wrist or the hand. And there's a lot of hypothesis that it can affect people with alcohol abuse, those taking anti-epileptic medication, and those working in jobs with a lot of vibration on their palms. Again, it strongly depends on the genetic element. There is no particular person who's strongly at risk, but I guess if you have a strong family history of Dupuytren's disease, then you're more likely to develop Dupuytren's disease. So surgery is not always required. The Dupuytren's disease is mainly a lifestyle-related condition. It depends on how bad the disease is and how much is affecting your function and quality of life. There are different ways of treating it, but once it reaches the stage where something needs to be done, then surgery is usually required. There's different forms of surgery that can be performed under local anesthetic, such as what we call a needle fasciotomy, which involves just cutting the cord that forms underneath the skin with a needle under local anesthetic, to bigger procedures. Steroid injections haven't been proven to be that useful. There used to be enzyme injections, which are no longer available in the European market and the UK market. And radiotherapy is also an option, but that's limited to certain cases in its early stages.